Let's see about flexible denture. So this is flexible denture. So flexible denture based material also called as soft dentures. So the polymerization shrinkage is conventionally cured polymethyl methacrylate led to the development of a special injection molding technique. So in flexible denture we using special injection molding technique. The first used material is fluoropolymer in 1962 and acetal in 1971. The used material here is nylon based plastic polyamide. The elastomeric resins added to the resin polymer, so it gives higher flexibility and it is strengthened with glass fibers. So the resin polymer is added with elastomeric resins, so it gives increased flexibility, and glass fibers are added to this, so it gives strength to the flexible denture. So the semi-crystalline nylon composition gives strength, flexibility, transparency, high impact resistance, color stability, high creep resistance, high fatigue endurance, excellent wear characteristics, good solvent resistance, no porosity, no biological material buildup or odors or stains. So low water sorption and good dimensional stability, monomer and metal free microcrystalline structure. It gives finish and polish the acrylic. So these are all about flexible denture based material. So the soft dentures are not the same as the soft reline for traditional dentures. So the soft relines use a soft putty-like substance to separate gums from the hard acrylic in denture. So it is not a relining material. So the flexible dentures use a special flexible resin that prevent them from shafting from gums, allows the wearer to chew properly. It provides soft base that prevent the gum from being rubbed raw. So it gives the protection for the gums because it is very soft and it is comfortable for the patients to chew. This is a flexible denture. So what are the commercially available products in soft dentures or flexible dentures are Volplast, Duroflex, Flexite, Proflex, Lucitone, Impact. These are all commonly available or commercially available products of flexible denture. So here the important point here is in flexible denture we added elastomeric resins with resin polymer. It gives the flexibility, and we added the glass fibers. It gives strength. And what are the advantages of flexible denture over commercial partial denture? So it gives translucency of the material and no clasping is visible on the tooth surfaces. It gives improved aesthetics, and material is strong and flexible, complete biocompatibility, and will not cause sore spots because it is very soft. And flexible denture rehabilitating the anomalies such as ectodermal dysplasia, and nearly it is unbreakable and it is stable and retentive and no metallic taste because here no metal is used, and it is non-allergic to the patient, and free movement is allowed by overall flexibility. So here it is built-in stress breaker. So there is it have a lot of flexibility, so there is a free movement. So this is all the advantages of the flexible denture. And what are the disadvantages? Extreme caution is needed before using the flexible denture. When processing to avoid skin contact with the heated sleeve, cartridge, furnace and heating bay, hot cartridge, injection insert, piston head adapter, hot flask and heat clamps. So extreme caution needed for using these materials or object. So they do discolor due to sorption. And what are the indications for flexible denture? full denture, partial denture, bases and relines. In cases with bilateral inoperable undercuts, when pre-prosthetic surgery is contraindicated, maybe we use flexible denture. And special applications, if we give TMJ splints and patients allergic to acrylic monomers and cosmetic veneers and gum veneers to mask gingival recession, and periodontally involved teeth, sensitive teeth, cancerous mouth or other conditions, we use flexible denture. So if the teeth are compromised, treatment involving high torus and cleft palate conditions and mouth guards in sports and bruxism splints, night guards, bite splint, space maintainer, pediatric cases and obturators, speech therapy appliances and orthodontic retainers. Next is flexible denture in combination with cost partial framework. What are the advantages if flexible denture is used along with cost partial framework? So the advantage is it eliminates most of the difficulty of recurrent source parts, framework resists movement and pressure from the clasp, and nearly it is invisible and gum colored clasp. These are the advantages. What are the disadvantages? Flexibility is not an advantage. No, there is no undercuts in a CD situation. It is difficult to use with less interridge space. So it is difficult in use in less interridge space. If we use flexible denture with the cost partial framework, we need more interridge space. And what are the procedure during the insertion? Denture is placed in very hot water, that is 150 degree Fahrenheit per minute prior to insertion and allowed to cool to tolerable temperature. Grinding is done and low speed of around 250 to 300 rpm using green stones. These are the insertion procedure for flexible denture. So this is all about flexible denture or soft denture. So this is the example of flexible denture in mandibular ridge. So it is the flexible denture in upper, that is maxilla flexible denture.